number 5, number 6, 7, and 8. And that's all of the areas of projection. That's going to reach there, and the central part of the cheek here. You want to keep this little contour, that little shadow. So typically what you would look to do is hyaluronidase takes the intracellular matrix of the adipose tissue and it decompresses it. Some of this is filler, some of this is water, because hyaluronic acid takes the water, blocks the lymphatic system and gets healthy. So when you inject the hyaluronidase, you disrupt the extracellular matrix, take the compartment pressure down, and all of a sudden they look like they're slim. It's a fantastic way to do it. Let me give you my secret tip for that. 1,500 IU hyaluronidase, okay, hyaluronidase if you get it here. 10 ml of bacteriostatic saline, not water for injections, it stings. Every aliquot you inject 0.03 in areas of excess. In areas of very fine anatomical sensitivity, 0.01. And every injection is going to be 5 millimeters apart. Okay? Yeah? So remember that, but then you can always ask me about that, you know, tonight or whatever, right? Okay, so now we have black means to go, red means to undo, to erase. Right? Good. So I think when I inject this patient, we're going to see enough of a good result just by injecting the projection. And we'll see a face shape change now. Okay, let's go. Temple, the cheek. What's going on? Just like this. What's going on? Right guys, so if you have a face which is heavy and you want to make it slimmer, do you go with a low molecular weight, so lighter product, a medium, or a heavy product? Heavy. Good. Most people think if you're only full, you need to use something less projecting, the opposite. You need to create power to lift all of the heavy stuff. Cool. Right. In my hand. Right guys, so let me teach you. So what you've got is you've got 3 different types of products. So you have, this is the heavy. In other words, if you look at hyaluronic acid concentrations, this is 75% biphasic, 25% monophasic. On the lighter end, you have touch. Yeah. This is 75% monophasic, 25% biphasic. So you've got a much lighter concentration. In the middle is a 50-50, which is body. So let me show you what I'm going to do. In the temple, let's imagine all the static areas, the frame of the face is going to be defined. We're going to use that as structural lifting. In the intermediate parts of the face where we need to have dynamic, well, I guess more natural results, we're going to use the body. In the anatomically sensitive areas that move the most, like the corner of the mouth and also the lateral canthus, is touch. See? And I'm just going to mention one thing as well. 27 years of injecting, like me and Yanni have known each other for 2 decades plus. So, I've worked for all Allergan, Beldome, Merck's. The portfolio ranges in all these companies are very big, sometimes 10 plus products. It's confusing for you guys. And how many times have you bought stuff? It's just sitting in the back of your cupboard for like 5 years, then it goes out of date and you put it in your mother-in-law's. So this is a non-confusing 3-step approach. I like simplicity, and especially simplicity that works as well. So it's basically light, medium, heavy. Simple. Very easy. Okay, let's start. So we're going to begin in the temple of Potter. Oh. Nice, very good. Thank you. So, in the temple, you've got a deep end and a shallow end. The muscle is thick, the muscle is thin. In the deep end here, you've got more risk because there's more vascularity. In the shallow end here, you've got less risk. So we're going to go in the superior medial quadrant here. And actually, if you rest on your back, that's good. And then turn, there you go, perfect. You can all see that clearly? Good, okay. So what we're going to do is we're going to go in this superior medial 1 centimetre down area. Look for any veins, feel for the pulse of the superficial temporal artery. Nothing there, looks good. So we're going to go down and we're going to project there between 0.3 cc and 0.5 cc. Little aspiration. So obviously it's a medium to high risk area. And I'm just going to now slowly inject. I want the product to hydrodissect underneath the muscle. So I'm on the bone and I don't move from the bone. One thing that I've seen here, by the way, guys, is the dermatologists amongst you, you tend to be used to doing a retrograde technique. Look how slow I come out here, and I come out slow because there's no blood. This is a building with now Sebastian Codafana has found 13 layers. But in this building, which is now on fire potentially in the lower layers, 2, 3, 4, if I come out slow and close all the doors behind me, the fire doesn't spread. I remember in Riyadh one time, plastic surgeon who's fast. He came out fast, the blood was shirt, because it came too fast like a volcano. Always enter fast, no pain, come back slow, so you close the doors, the fire doesn't spread, okay? So there's the first, now look, only the blood comes now, see? Just well, and it's coming very slow because it's trapped in the bottom. Okay, good. So now we're going to mold what? Your molding needs to be directional and purposeful. And then you hold it in position. The purpose of doing this is to lift the brow, to increase the height of the upper eyelid. She's done a beautiful wing liner today. I'm going to increase the frontal axis there, and then she'll be very happy going. So let's step forward. There you go. Okay, so just so that you understand that I'm not bullshitting you, I've done everything that I said I was going to do. Because the rheology has done the work for me. Lifted the brow, it's lifted the eye. Her eye's more open. Can you see that? Her eyes, why is that? I've dilated the orbicularis ocular muscle so the eye becomes wider. It also starts to rotate the soft tissue in this direction. So you can see some changes in the lower third of the face whereby even the excess in this area is a little bit, has more traction. Okay, let's continue. So we're going to stay with this product. So we're going to go with the Define. We're going to pull back. You can see that there's a very slight depression here. This is the lateral zygomatic cutaneous ligament. It's the insertion from the skin. It's the union from the bone to the skin of the ligament, which is falling forward, creating a depression here. Find the depression and inject just in front of it so that you can push it back. Don't inject laterally because you're just going to widen the face. So let's watch out for that. So we're going to pull the ligament back. In other words, the ligament has now gone from there and it's gone there. Now I'm going to inject just in front of it and from a vertical position because I wanted to create a nice high cheek bone. Nice and quick entry. And you're looking at about 0.2 cc for this. a new one. Okay. Full faces, high G prime, higher volumes. They're more expensive to treat. I'm injecting her like a guy, because men have bigger skulls. She's almost presenting like a big skull. Okay, now again. And then what we're going to do, we're going to see the second black dot, and we're going to come just in front of it, but avoiding this area here, which is this is her enemy. Okay, this is going to cause problems. It's going to make her look worse if you inject this malar edema. Okay, it's another no-go area. You can't go into that, so we're going to come just below it and in front. Right, now then, look, we're going to go just below and in front of this position. This is the medial aspect of the cutaneous zygomatic retaining ligament. So pull that back, and then I go onto the bone, well done. And I'm going to teach you a technique which we call push bolus technique. This is something that me and Arthur Swift do a lot when we do live performances. We take the ball of the product here, and then what I do, I just paddle. Come forward, come forward. So I want this ball here to go up underneath the orbicularis ocular muscle, to lift the muscle up, to create a space between the skin and the bone, so that we make the tear trough better. It's a very nice technique because there's no blood and no complications. So you go up like this, and you just paddle it up. Just paddle. And I'm squeezing it, like I'm making flat bread from a dough ball, and I'm like rolling the dough into a flat sheet. So I do this, rotate, 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 and then it occupies the premaxillary sulcus. So now, forward, forward, okay. Look at this, everybody. Look in the camera, thank you. Right. I haven't even touched the tear trough, I haven't touched the lateral canals. Her eye is upgoing, the tear trough is gone completely. The other side has a dam going there, and it has a dark circle. I've made it brighter because the rheology of the product, the rheology of the material is as such. So, that's like a decent little bolus. Can you see how the little bolus here is bright like the diamond bracelet? And that's because it's a light reflector. This broad spectrum lighting is hitting the product and it's reflecting the light like a mirror. The other thing is, that in the rainbow, when the light hits water particles, it goes from red, orange, yellow to then green, blue, violet. Low wavelength is red, orange, yellow. High wavelength is red, blue, violet. What happens then? Red, orange, yellow. Ladies, who did concealer today with their eyes? Anybody? You? Right, listen, just fine, you can lie to me. What colour is under eye concealer makeup? What colour is it? No, what colour, darling? Do you know the answer to that? I do. It's peach, man, peach. Orange, orange. Orange is a light absorber. This reflects light in the low wavelength, so it turns the skin from a dark circle into a brighter circle on the right. Okay, let's go. Right, guys. So I did the structure, structure, structure. Now I'm doing texture. I'm doing the lateral orbit. And look how it comes. Let me show you again. How much you want the 0, 2, 0, 3, 0. Right, watch this, guys. Look at out of the two, guys. Just one second. This is the define. This is a higher molecular weight. This is the touch, lower molecular weight. Which one is brighter? Touch. low. It's the low molecular, integrated rheology, and that's why I'm going to use it for the under eye. So, my love, eyes to the ceiling, look up, thank you. And then we can see where all the deficit is. So we've got one area of weakness here. No, just relax, it's fine. And we have this running all the way to the lateral campus. The reason why I know she's going to love this is because she has done the wing liner today, which tells me she likes to have a positive climb on the actual border of the eye. Okay, good. Good. Okay, now watch this. This is like magic. Without moulding, it's already gone up quite nicely, but then if you touch it a little bit, and you start to integrate it into the tissue, like this, come forward. Right, look at this now. You've got like another Dreamliner 787 wing tips. That's what she wants. She told me that's what she wants without speaking to me. She did the makeup today with the black wing liner. So you don't need to speak to the patient, but she's telling me everything that I need to know. Now we're going to come on to the lower face, back to define now, so high, deep, prime, lift capacity, strong. And we want to do 1, 2, very important this one, 3, and then we're going to use soft authority. Right, good. Look how I'm all the way to the bone there, very important. You've got where my thumb is you've got the facial artery, where my finger is external carotid. Okay, good. Now, what's happened here is when whoever's done this jawline, they've put all of the stuff here, but they omitted this section, which is the most important part in a woman. So I'm going to fix that now by moulding it in like this. Then we're going to fix this pre-jowl sulcus notch. Now, put your non-dominant index finger underneath the mandible, like so. This does two things. It shapes the product for you, but the other thing it does, very nicely, it stops the migration of the product down into the submental area. I think, listen, I've got this other suspicion. I think that she's had migration of the filler in the submental, and that's made her have a double chin. But look, I'm going to protect that area now like this. Oh, here we go. You're a bit unfocused. This is like look, I've done two boluses, and I'm going to let them kiss each other so we make a nice straight line. Keep it going. And listen, you're going to do the other side. So get ready for that. Yes, you are. No, they're going to go. They're going to float. No, you're going to do it. Huh? Right, guys, look what I've done here. Actually, can we clean the dots now so they can see from this video light? I'll actually know this time. Once. Right, guys, just before I continue, I'm going to clean all this skin. I'm coming to the end of this side now. I want you to see this very clearly, the result, yeah? You know what? You know what I said to you? I said 10 plus for beauty, 8 for the attitude. So we're doing it. Okay? I'm not taking no for that. Tell it. What? No? You don't have a choice. Right, we're going to close with this now. Right. So here's a really handy tip. Here's a handy tip for you guys. Use your fingers to mold. It's free. But take your time to manipulate the product so that you get the desired outcome in terms of the structure. Remember, light, shadow, light, shadow. You want to create more of a demarcation to help the patient with the definition and slimming of the face, right? So look, fingers, finish this one. No. So what we want to do here is, I want to have two fingers on the inferior border of the mandible. Come this way, thank you. Okay, good. And what I'm doing is I'm pushing into this little triangular fossa. Lovely, little dot now. Yeah, that's fine. So the objective here is to create a straight line where the untreated tissue is like a kink, like a roller coaster. And there we go, I think we've done that. Now we're just going to climb up the Marinette line. So to here, and then to here. Lateral labiomental crease, up to the oral commissure. And then we're going to finish now with a very soft touch here. Touch my third. Wow, good. Okay, let's have that. Yeah. Well, then just. Okay, good. Right. Let's get you like that. Thank you very much. Come forward. Forward. Right, everybody. I think this kind of concludes the example I'm trying to set here. Okay, good. Right. Excellent. I'm really happy with that. The chin. Look at the projection here. I don't want it to be too forward. Yeah. The other thing is that it's particular to this country and also other Gulf countries. The chin crest, the bifid muscle, is a gift from the father. And when you treat it and you don't have consent from the dad goes mad. And when he sees you having dinner or something, he goes, "What? Where's my chin gone?" Got to ask. Okay, look now. Let's go through all of the. Look in the camera. Let's go through all of the wings. The brow is up. The eyelid is taller. The canthus is elevated. The eye is wider. The cheek is defined. The jawline is sharper. The pre-jab sulcus is better.
What's the joke?
And look, everybody, I think one of the good things about facial vectors, sad eyes, sad mouth. Look, her mouth is now neutral to happy. On the other side is sad and eccentric, like the eye and like the mouth. So I hope that teaches you a few things, little tricks. Use the weapons that are available to you and look at the molecular weights in the G-prime and tissue tailor your treatment according to the face shape and also get the ratios and the geometric angles, heights and widths correct. So on that note, I'd like to thank you all for being here today with us, and we'll see you tonight at the show. Yeah, we're going to put on a really good show, me, Yanni, live, big thing. So yeah, you'll enjoy. Thank you.